as always, I'm trying to bring you something that's very interesting. I'm going to show you how to balance digestive issues, blood pressure issues, depression, any kind of inflammatory conditions. Sound like something that's of interest to you? Well, stick around because we are going to be talking about something called the vagus nerve. Vagus nerve, unlike Las Vegas, Vegas is Latin for wanderer. Wanderer means it's kind of wandering all over your body. So the vagus nerve is also part of something called the cranial nerve. It's the cranial nerve number 10. Starts right at the base of your skull, kind of goes right through your neck, goes into your heart, your lungs, your liver, your small intestine, all your digestive tract, your kidneys, everywhere. This is the longest nerve in our bodies. Now, what makes this vagus nerve very important or very interesting is because it's also what is known as, it's a sensory nerve and a motor nerve altogether, which means it sends messages from your brain to these organs and relays messages back from the organs, or how well the organs are doing, back to the brain. It is the biggest thing in what is known as our parasympathetic system. Now, you've heard me talk about these things, right? Your sympathetic system is the fight or flight. This is our normal everyday life. This is how we live, right? We're always stressed and tensed, and heart rates are up, your blood pressure is up, your muscles are always very tense. That is the sympathetic. That's your fight or flight. You see a lion, you want your adrenaline to kick in, everything jumps up, you run away. But then we have something called the parasympathetics. This is your body's rest and digest and repair. This is where your body calms certain things down. It allows other things to happen, helps your body repair things from what, things that are damaged or that need to be rebuilt. So that's why the parasympathetics are very important. If you're always in that sympathetic state, you're not allowing your body to rest and do what it's supposed to. And that's what is leading to a lot of chronic illnesses nowadays. So there's something known as your vagal tone. So how do you know your vagal nerve is working okay? Right? No, there's no way to just kind of suddenly look in there and see what's going on. So there's certain things you can do to find out how something called the vagal tone, to see how your vagus nerve is functioning. It's a very simple technique. You can do this right now with me. All you want to do is put your hand on your pulse. So find a pulse, put your hand in there. This is related to your heart rate and your breathing rate. So all you're going to do is put your hand there, find your pulse, take a deep breath in. If you notice, when you take a deep breath in, your pulse rate goes a little bit higher. You notice your heart rate goes just a little bit faster. And then when you breathe out, your pulse or your heart rate kind of goes a little slower. So that breathing in part is your sympathetics, it's getting you all ready. And then parasympathetics is the breathing out. That is one way to do that. Now, the vagal tone also tells you how fast your body can recover from any kind of stress. That's a big thing nowadays, right? So again, not just from exercises and stuff, from any kind of stress in your body, you want to be able to recover better. So that breathing thing that I just showed you, you want to see the difference between the heart rates, right? When you breathe in and when you breathe out. The higher the difference between these two, the better the higher your vagal tone, which means your vagus nerve is working much better. So that's one way of finding out what's going on. Now, the higher the vagal tone you have, which means if your vagus nerve is working better, it helps your body handle sugar better. You're helping your blood pressure issues, because I said parasympathetics. Your depression, anxiety levels are lower. Autoimmune conditions, your body's working the way it should, so it's not going to fight itself. So those are a few things that it can help. So many different things are controlled, or so many issues can be controlled by just allowing your vagus nerve to function, or make sure it's functioning the right way. Now, how do you do this? As I promised you, I'm going to show you 5 different ways how you can sit around at home and just do these things yourself. Because nowadays they actually have little implanted devices that they're implanting in our bodies to stimulate vagus nerve for some people. Just like you have a pacemaker for the heart, this is a new, it's called a vagus nerve stimulator, which they implanted your body to stimulate that for people with things like epilepsy or chronic migraines or fibromyalgia, those kind of conditions. Well, you don't need an implant. Why do you want to go get something so invasive, right? I'm going to show you how you can do certain things at home to help stimulate your vagus nerve. So let's talk about the 5 things that you can do just sitting right there to help you stimulate your vagus nerve and make it work the way it should. First thing, very simple, slow breathing. We have almost forgotten how to breathe nowadays. If you're a patient in my office, I always tell you, okay, hold on, slow down and breathe. Because you want to be able to, calm the body down just from simple breathing techniques. When we ask somebody to take a deep breath in, what happens? Take a breath in with the shoulders coming up. That's not how you take a deep breath in. It's the whole diaphragmatic breathing. If you're a singer or somebody that played a wind instrument, you know that they talk about how to breathe through your belly. right? In yoga, they teach that, the baby's breath, the breathing through your belly. So what I show my patients is put your hand on your belly, take a deep breath in. Your belly comes out when you take a breath in, and your belly should go in when you breathe out. So not a thing like that. Try it. It sounds a little difficult. It's almost like you're going to have to retrain your brain to breathe the right way because you're getting more oxygen in your body. So small, slow, rhythmic breathing. You're just taking a nice, simple, deep breath in, and you breathe out nice and slow. Helps kind of calm not just the brain down, but also stimulates your vagus nerve because it's parasympathetic again. Now, this is one of my favorites. I've done a lot of research on this thing. It's something called the box breath. This is something that takes a little getting used to. It's just a little training to do, but it's wonderful because it stimulates it even better. So the box breath means you're going to inhale for 4 seconds. You're going to hold the breath for 4 seconds, and then you're going to exhale for 4 seconds, hold the breath out for 4 seconds, and then breathe it back in. So you're just creating that small little rhythm like that, right? In, hold, out, hold, that way. 4-second breaths works out better. If you can even do it longer, more power to you. It's wonderful. But slow, rhythmic breathing, wonderful for the vagus nerve. Second thing is, I'm a chiropractor, so get a chiropractic adjustment. As I said, the vagus nerve exits right at the brain stems, right at the base of your skull. If there's any kind of pressure that's being put on by any of your vertebrae being out of alignment, your vagus nerve is not functioning well. So get to a chiropractor, come to our office, we'll check and make sure your everything is functioning well to allow your vagus nerve to function better. So a chiropractic adjustment is wonderful for that. Third thing is humming. You've heard some people, even in yoga and all that stuff, they talk about just humming or just saying om under your breath, right? That thing sends out vibrations throughout the body. Those vibrations stimulate not just the vagus nerve, but almost everything in your body. So humming, singing a song under your breath, just while you're humming a song, those kind of things stimulate all of this stuff. Fourth, again, we know about this. Have you heard me talk about meditation? Meditation just is that mind-body connection, just allowing your brain and your body to connect with each other and for you to be just one with yourself. Simple. You don't have to do 30-minute meditations, even a 5-minute simple breathing while you're sitting and just being aware of yourself is considered a meditation. Sit down and try that. It just kind of releases everything, relaxes the body, turns on the parasympathetics again, the vagus nerve. Now, the fifth one is certain minerals. There are certain minerals which are known to calm the body down. You've heard me talk about potassium, magnesium. These are things that are wonderful for the body in a lot of different ways, not just for the muscles, but they just kind of calm the body down. So doing a few of these things are going to help stimulate your vagus nerve. Try it out at home. It's simple. It's nothing that you have to go out and do anything special for. So try this, see how it feels, and trust me, you will notice a significant change in a lot of different chronic illnesses and conditions. So I hope this information has helped. If you know anybody that would benefit from this information, as always, please share this information. And if you have any questions and comments, post them below. And let me know if there's any topics that you guys are interested in hearing about. I always pick different topics. So we'll talk about something that maybe, that you want to hear about. So drop me a line and I'll see you in the next video. Thank you.